Hey, this video is for those folks who have tried Ozempic and Semaglutide kind of injection and has not worked for them. And so I wanted to touch some points here. Why some patients don't lose much weight on semaglutide. And I have a bunch of patients, a smaller number though. Um, and Number one is no change in eating behavior. See, semaglutide reduces appetite and cravings, but it does not erase your learned behaviors like emotional eating, snacking out, or boredom, or social or trigger based overeating. And if someone continues to eat calorie dense processed food, sweets, and then medication can't overcome that surplus. So it's really important that you make changes in your eating behaviors. Got to go together. Number two, compensatory behaviors. Some people shift from large meals to frequent small snacks or calorie rich beverages, and that does not help. Alcohol and liquid calories like juices, lattes, sodas, even diet soda, they bypass satiety effect of GLP-1 drugs. So, so you need to make changes over there, and dose and duration factor. And clearly, some people are underdose as well. So I try to keep going up on their doses until I feel after interviewing patient that which gives me indication that their appetite is sufficiently suppressed. Um, and some people are slow to show the effect of GLP-1. Their weight loss is very moderate and not as dramatic, and it takes time. So it has to do with the individual metabolic regions, biological variability, and genetic and hormonal difference affects response. So that's the one I was talking about. Genetic and hormonal differences exist from people to people. For example, GLP-1 receptor sensitivity and gut microbiome composition or baseline metabolic rate will blunt the effect. So it is really important that you use probiotics and you use fermented foods on daily basis, and you eat a small dinner with the greens and vegetables. You need to improve your gut health. And if the gut health is poor, semaglutide is not going to work very well. And sometimes there's underlying medical issues, like for example, if somebody has hypothyroidism and it's not controlled, then it's going to have a blunted effect. Somebody may be on medication like steroids and antidepressant and insulin, and they can also counteract the effect of weight loss. And the other is mindset and expectation. Some patients view the injection as magic bullet, and that's not the case. And they want injection to do everything for them, and they don't want to make change their behavior. They don't want to change their eating pattern. Then there's a problem. You have to shift your mindset and lifestyle support. But because without any, if you think that if you expect results without effort, that's going to lead to frustration when the weight loss is modest. So what I wanted to tell you is that, see, GLP-1 medication, they're tools, they're not cures. And your insurance is covering only for few months, 6 months, sometime even a year. But more and more denial I'm seeing these days now. But they work most effective when they are combined with a structured nutrition plan. And in my patient, I give them a structured nutrition plan which is 40% calorie for breakfast, 40% calorie for lunch, and 20% calories for dinner. And out of that distribution 40-40-20 meal plan, the macronutrients, the protein should be 40%, fats should be 40%, carbs, complex carbs should be 20%. And that will give you the maximum result. So a structured nutrition plan is important. Behavioral modification, addressing emotional eating, what triggers you, you got to know that, and you got to change that triggers. Regular follow-up with your doctor, sitting down and finding out what's causing the triggers and finding a solution for those triggers is very important. And when I sit down with a patient, that's what I do. And also the dose optimization is very important. Motivation from your provider works very well. Some people are self-motivated than others. Others, they need more support. And I'm happy to give them that support. If you have any question, drop that in the message of this video. And you can always ask for free consultation. You can email me at consultation@drpklife.com, drpklyfe.com. So this is Dr. Quran. Thank you for watching.